Yes.
Well, good evening, everybody. My name is Zara Rothenberg. I am licensed by the state of California regarding health insurance. And I'm also certified by multiple health insurance companies to provide their products to you. Tonight, we're going to talk about Medicare Basics. The topics that we are going to cover is your Medicare choices. We're going to talk about what is original Medicare and what are the eligibilities, periods that you're eligible for Medicare. We're going to talk about Medicare Part A, B, C, and we're going to talk about Medigap, which is also known as supplement plan. And then we go into the prescription drug. We talk about different stages of drug and different tiers of drug. And finally, briefly, I covered extra help with prescription drug. Now, throughout the presentation, I'm going to pause and I'm going to see if you have any questions. Please, if you have any questions, put it in the chat. If your question is really specific and unique to you, I'm going to ask you to wait until the very end to ask your questions so that I can finish the presentation in 1 hour. And don't worry, I'll stay as long as it takes to answer all of your questions. Okay, so Medicare. Medicare consists of two parts, Part A and Part B. When you turn 65, if you have worked for 10 years or 40 quarters, and you have paid your Social Security and Medicare taxes, you are entitled to Part A and you are eligible for Part B. Part A is for inpatient hospital. That means you have to get admitted to the hospitals. Part A does not have a premium and it covers 100% of the cost. However, it has a large deductible. Part B, on the other hand, it covers outpatient hospital, your doctor visit, your lab work. Part B does have a premium and it only covers 80%. And it has a small deductible. Now, don't worry, I'm going to give you this amount in a couple more slides. So then A and B combined is referred to as original Medicare. When you apply for your Medicare card, you get a red, white, and blue card. It would have your name, it would have your Medicare number, and it would have an effective date for your Part A and Part B. If you apply for Part A and Part B at the same time, obviously your effective date would be the same date. If you apply at a different time, for example, when you turn 65, you're still working and you have creditable insurance through your employer or your spouse's employer, then you may choose to go and get your Part A, which is not going to cost you anything, and then wait until you retire, and then you apply for your Part B. In that case, obviously, the effective date for A and B are not going to be the same. When you apply for Part B has a premium, but this premium for Part B is paid to Medicare. So any issue, any questions on A and B, you deal with Medicare. When you apply, you can apply either online or you can call them over the phone, or you can go to your Social Security office in person, which nowadays nobody does the visit in person. So basically, this is your A and B. Now, because A has a large deductible and B only covers 80%, and combined, they do not cover prescription drug, most people, after they get their A and B, they go to private insurance company to get additional insurance to complement what A and B does not cover, so they get a full coverage. When it comes to going to private insurance company, basically you have two options. Option one, in addition to your A and B, you apply for a supplement plan, also known as Medigap. So basically, the Medigap fills in the gap that A and B does not cover. It covers the large deductible here, and it covers the 20% here. That's why they call it Medigap. So the Medigap plan has advantages and has disadvantages. The Medigap plan is very flexible. Once you have a Medigap, there are multiple plans within the Medigap. So you choose which plan best fits your needs. So once you apply for a Medigap, you can go to any doctors, any hospitals, anywhere in the whole US, as long as they accept Medicare. So let me repeat that. As long as they accept Medicare, because not every doctor or every hospital accepts Medicare. So this is a very good thing. It gives you really flexibility. If your doctors are scattered all over and you're really attached to them, you can keep the same doctors as long as they all accept Medicare. The disadvantage of the Medigap plan is your premium goes up by your age. So when you're 65, you start with a certain premium, depending on the plan you sign up. And then when you turn 66 on the month of your birthday, your premium goes up. And then 67, 68, 69, it just keeps on going as you get a year older. The other disadvantage is the Medigap plan does not provide you prescription drug, also known as Part D. So once you have the Medigap, you have to go to private insurance company and sign up for a standalone prescription drug. And then obviously you would have a separate premium for D, and you would have a separate premium for your Medigap, and you would have a separate premium for your B. So if you choose go with option one, you carry 3 cards with you at all times. You would carry your Medicare cards for your Part A and B. You would carry your supplement, the Medigap card for the gap, for the 20%. And you would also carry a prescription drug card. So this is a combined, is a full bundle that gives you full coverage. The other option is to go with, it's called Medicare Advantage or Part C. Some years ago, Medicare realized that they're spending a lot of time and money for the administrative work and processing the claims, that they made contract with private insurance company, and they said, okay, for every individual who is part of Medicare, we give you a certain amount of money every year, and you go and take care of all their medical and hospitalization and all the claims. Now, this is then called Advantage Plan or Part C. If you choose to go with option 2, you do not lose the benefits that you had under A and B. All those benefits are embedded in your Part C. So Part C basically covers all the A and B, but then gives you additional coverage. The disadvantage of this plan is this Part C plan is generally either an HMO or a PPO. An HMO means that you belong to a network and you cannot go outside of the network. And if you need to go and see a specialist, your primary doctor has to refer you. PPO also has a network, but you do not need referral to go to see a specialist. And also it allows you to go out of the network and see other doctors, but you may have to pay extra once you go out of the network. So in a way, this is a disadvantage because you're really restricted to the network of HMO or PPO, what your plan offers. But the advantage of this, the huge advantage of this Part C is, first of all, your premium doesn't go up by your age. So whether you're 65 or 95, you pay the same premium for the same plan. The other thing is some of the plans, when they are offered, they have even zero premium, depending which county you live and what's available in your county. So this is a huge advantage. The other big advantage is this Part C also provides you with prescription drug. So that means you don't have to go and pay a separate premium and get a standalone prescription drug. With the same premium you pay, even if it's zero premium, your prescription drug plan is covered. And in addition to that, many plans offer you extra benefits, such as they may give you certain allowance for over-the-counter drugs. They may give you gym membership. They may give you certain number of ride and transportation to your doctors and pharmacy. So this, you get a lot with this plan. So at this point, a lot of people, when I talk to my clients and I meet with them to discuss what their options are, they all ask me, well, Zara, which one do you think is better? And my answer always is, it depends. It basically depends on your needs and what's important to you and you know, what your situation is. For example, if your doctors are scattered all over and you really are so attached to them, you don't want to change them, you have to go and you want to go and see the same doctors, then obviously the Medigap plan is a better plan for you because it gives you the flexibility. But then you have to realize you have to pay more. But on the option 2, Part C, if let's say all your doctors and specialists are, let's say, in Palo Alto Medical Foundation, and you only go to one center to take care of everything, then you may think, well, why do I need a Medigap? I can get a Part C and get a plan that covers this certain medical group, and then I can continue going there and taking care of everything and pay less. And in addition to that, get the prescription drug and get the additional benefit. So it really depends on your situation. It's not a one size fits all. Sometimes the husband may want to go with the Part C and the wife may want to go with the supplement or vice versa. That's okay too, because each individual, even married couple, they each have their own Medicare plan. It's not a combined plan. So when you sign up, if you start with the supplement plan during the, and I'm going to talk about different enrollment period, but once a year, you have the opportunity to go from a supplement and change it to an Advantage plan, which is the open enrollment. During this period, when you move to a Part C does not ask you any medical questions. They don't care what is the pre-existing condition, as long as you live in you're 65, you paid your taxes, you have your Part B, A and B, and you live in the county, you qualify, you sign up for Part C. But if you want to go from option 2 to option 1, if you want to go to Medigap, then you may be subject to medical questions, depending on your situation. Again, you have, it's always good to talk to somebody expert to see what your situation is and whether you're subject to medical questions or not. So you need to know that. So at this point, Nevin, I'm going to stop and see if they have any questions because I covered a lot of information.
Okay, please, thank you, Zara. Please type your question in the chat so I can read them to Zara. If you have any questions, we will wait a few minutes. So while Zara, while we are waiting, if people have questions, if they are typing, I have a question. So if someone just enrolled for parts A and B, would this be enough for basic things? Because these option 1 and 2 are additional coverage.
Yeah,
right?
it's, and I'm gonna cover it later. If you, A and B, if you only get original Medicare, it covers the requirement for A and B, which means then if you don't have any other insurance, you would be subject to paying the large deductible, and you are subject to pay 20% every time you see your doctor or if you have an outpatient hospital. And then you also don't have drugs. Now, if you turn 65 and you don't, and I'm going to cover that in a few more slides, but I'm going to answer your questions. So if you only have A and B and you do not have any other creditable insurance through your work or your spouse's work, so you still need to get D. You're not forced to get Medigap or Part C, but you have to get D, otherwise you get penalized. And I'm going to cover that in a minute. So the very, very basic is to get A and B and D.
I see, thank you.
But then you got to realize you have to pay a lot of expenses.
I see. So we have 3 questions so far. If you tend to travel international a lot, is one option better than the others?
Okay, both of these options cover emergency even abroad. So whether you have option 1 or option 2, if you're traveling, you're even traveling anywhere in the country or outside of the country, if it's an emergency, you cover. Of course, emergency is something like is either life-threatening or something that requires immediate attention. But if it is not an emergency, the Medigap, remember I said it covers you anywhere in the whole US as long as they accept Medicare. So if you're traveling within US and it's not an emergency, as long as you go to a doctor who accepts Medicare, then you're covered with the Medigap plan, but you're not covered with the Part C. Part C, you have to be within the network of your plan.
Okay, thank you. So what kind of medical screening are they concerned for option 1? And do those questions make it so you might not accept it?
Well, yeah, there are major operations such as cancer, heart attack, hip replacement, knee replacement. Those are the major issues that is very expensive. So there's a list of questions. So if you plan to sign up for, when you turn 65, you're guaranteed you can get in no matter how, you know, how many pre-existing condition you have. You're guaranteed you get in. But once you get in is the issue. Let's say once you turn 65, you go to a Part C plan, and 2 years later, you want to go to a Medigap plan. At that point, they're going to ask you medical questions. So in that case, you really need to, if you already have a pre-existing condition, you may want to consider just joining the Medigap when you turn 65, because then you would have a guarantee you get in.
Okay, thank you. If I keep the same supplement and drug plan, do I need to do anything during the open enrollment?
No, no, any of this thing, whatever plan you have, if you're happy with it and you do not want to change it, you don't do anything, it automatically, January 1st, it rolls over to the new year. If your rate premium changes for any reason, you usually get a letter from the provider to say, now you're from the plan, to say that now your premium is going to be $5 more or $5 less. But other than that, you don't have to do anything.
Thanks. Another question, excluding provider in general, is cost depends on assessed and incomes, meaning millionaire pays more than worker making $15 per hour?
No, the provider goes by the providers are really the doctors. So the plan, when the carrier, the plan, when you sign up for a plan, any doctors in that plan is available to you regardless of your income. So, excuse me. So any doctors in that plan is available to you as long as the doctor accepts new patients. So nobody looks at your income. None of these plans ask you for your income. So if you can afford to pay the premium, you get in.
Thank you. Also, thank you for your question, Archana. Yes, we have a question about green card, if I'm eligible, if not. So we will be answering those questions at the end, right, Zara?
Okay, yes.
Okay, yes. And then another question. Now my employer provides the fully paid medical insurance to me. Should I still apply the Medicare?
Okay, if your employer provides the full coverage, what's they consider creditable insurance. Creditable insurance is an insurance coverage that is at least as good as Medicare. And most large companies, their insurance is creditable. If you're in doubt, check with your HR and make sure that the insurance that your company offers is creditable. So if you already have coverage through your own insurance and through your spouse's insurance, then when you turn 65, you do not need to go and apply for Part A and Part B. Sometimes Medicare, since Part A is free, they may just issue you Part A and send it to you because you don't pay, there's no premium for Part A. But Part B, definitely, as long as you're working, do not apply for Part B because this has a premium. Why pay an extra premium when you have a creditable coverage to your work?
Thank you. Another question about living abroad. I think you answered it, but maybe needs clarifying. If one is living abroad, let's say in Europe, and wants to go for checkups while living abroad, does Medicare cover any expenses?
No, only emergency.
Okay.
Checkup is not covered. The Medigap gives you a small allowance, even if not emergency, but generally the checkup is not. See, they don't want you to go abroad and go and see another doctor. But if it's an emergency, they cover you. If you plan to travel, make sure you visit all your doctors and you fill up all your prescription and everything is ready. So when you go, you don't need that.
Thank you. There is two more questions. In Tricare for life considered a supplement or advantage plan?
Tricare is with the veterans.
I am not sure. This is only question I'm in.
Yeah, if it is the veteran plan, you can get either one. You can get, in addition to your veteran coverage, you can go and get a Part C plan. So that gives you better options, or you can go and get a Medigap.
Thanks. And last question is, what if I have been on Medicare for several years and I get a job with insurance coverage? What happens then?
Well, if you have been on Medicare Part A and B and maybe Part C and Medigap, and you go get a job that gives you creditable insurance, at that point, you really need to inform, you need to drop your option 1 or option 2 because you don't need 2 coverage. And you can inform Medicare and stop your Part D coverage because you already have a creditable insurance. And then at any point when you lose that job or you decide to retire, then you can go and reapply for your Part B and then come back and reapply for one of these plans.
Thank you. These are all questions we had.
Okay, so we move on. We'll stop more and answer more questions. So here I'm going to tell you a little bit more about Part A and Part B. Again, when you turn 65 years old, if you have paid your, for 10 years or 40 quarters, you've paid your Social Security and Medicare taxes, you are entitled to your Part A and you're eligible for Part B. Now, some people who are under 65, if they have disability and they have been on disability for at least 24 months, they qualify for Medicare. Also, if people are on with end-stage renal disease, that's kidney dialysis, or ALS, they qualify for Medicare. You have to be a US citizen or a legal resident who has lived in, excuse me, who has lived in US for at least 5 consecutive years. These are the deductibles that we talked about previously. So again, Part A is for inpatient hospital care. That means you have to get admitted. It has a 0 premium, but it has $1,484 deductible for the first 60 days. Now, when I say deductible, deductible is once a year. So at the beginning of the year, if your plan has a deductible, you have to pay the deductible before the Medicare or insurance company helps you with the payment. So if you stay at the hospital beyond 60 days, for days 61 through 90, you pay $371 per day. And then beyond 90 days, every year, you have another 60-day additional lifetime days. So at that point, you pay $742 per day for the lifetime 60 days. So for example, if the first year you stay in the hospital for 92 days, up to 90 days, you go per this deductible and this rates. And then the last 2 days, you pay $742 per day, and then you dip into your 60-day lifetime. So you have 58 days left. Now, these numbers, they're all 2021 numbers. I got them from Medicare website. They have not updated their numbers for 2022 as of 2 weeks ago when I put these slides together. Once they update their numbers, I would update my presentation. So quite possible all of this would go up by a few dollars. So Medicare Part A, in addition to inpatient hospital, it also covers inpatient skilled nursing for the first 20 days. And then after that, up to 100 days, you pay $185.50 per day. It covers home health care and it covers hospice. Now, remember, this is what Medicare Part A you have to pay. But if you get option 1 or option 2, those option 1 and option 2, the Medigap and Part C, they cover this cost. So you no longer have to pay this cost. This is only if you have Part A. So we're going to move on to Part B. Part B is for the services you receive from your doctor or healthcare providers. It's also for outpatient care. It provides, covers home health care. It covers durable medical equipment, like a special bed or wheelchair. And it covers some of your preventative services. Excuse me. So Part B, remember I mentioned that it only covers 80%. So if you only have Part B, A and B, your medical cost is only covered at 80%. The minimum premium for Part B in 2021 is $148.50. Now, this is the minimum premium. The Medicare assess, they look at your adjusted gross income when you file taxes. And if your income is below $85,000 for an individual and below $170,000 for a married couple, then your base premium for your Part B is $148.50. If your income is higher than those thresholds of 85,000 and 170,000, then they have you pay your premium based on how much more you made, whether you made 190,000 or whether you made 350,000. So they look at that and then they reassess what your premium should be, because this is a base premium. And then in that case, you would receive a letter from Social Security saying, because of your income, you have to pay more. And if you collect Social Security, they take this $148.50 out of your Social Security. They don't even give you an option. That's a must. But if you do not collect Social Security, then they would invoice you and they ask you which method of payment you like to make the monthly payment. The deductible for Part B is $203. Again, this deductible could be covered by your option 1 or option 2. But option 1 and option 2 does not cover your premium. Regardless of which option you choose, you have to pay your premium for Part B. What's very important is if you turn 65 and you do not have a creditable insurance through your work or through your spouse's work, and you choose not to sign up for Part B, because you may think, well, I'm really healthy, I never go and see a doctor, never see anybody, so why should I pay $148 when I get sick? I'll go and sign up for Part B. No, it doesn't work that way. If you turn 65 and you do not have creditable insurance and you do not sign up for Part B, then you're subject to 10% penalty for every 12 months that you did not have insurance. Now, the trick here is this penalty is for the rest of your life, or as long as until you go and apply for your Part B. As long as you keep the Part B, you have to pay the 10%. So if for 3 years you decide you don't want to sign up with for Part B, then the penalty would be 30%. So, and then that 30% is added to your premium for the rest of your life, or as long as you're applying for Part B. So it's very important. It's not just for the 3 years that you did not sign up, it's for the rest of your life. It's very important. If you turn 65, you don't have any other insurance, get your Part B. That's a must. Okay, now we go to Part C. Part C is now the private insurance company. This one is the option 2. So option 2, as I mentioned, Medicare has made contract with private insurance company so that Medicare pays them a certain amount of money per each member, and they take care of all your medical processes and claims. Now you have to have A and B active. In other words, you have to continue paying your B and you have to have your A in order to qualify for Part C. Usually Part C includes prescription drugs, and many of them includes additional benefit like gym membership or over-the-counter allowance for your over-the-counter medication. And the premium and the deductible would vary by insurance company and by the county in which you reside. So basically, it could go anywhere from 0 to 100 and, maybe 120 even. So it all depends which plan you choose, which county you live, and what benefit you're asking for. So it's very important. So moving on with Part C, to be eligible for Part C, you only have to be signed up for Part A and B, and you have to live in the plan service area, which is usually the county where the plan is being offered. They don't ask any medical question and no pre-existing condition. As long as you pay your A and B and live in the service area, you can get in. Okay, now we go to the option 1, which is the supplement. So supplement is also provided by the private insurance company, and basically it fills the gap that the original Medicare does not cover. And you have 6 months from the date you get your Part D to get into a supplement plan without, regardless of the pre-existing condition that you have. You're guaranteed you can get in. It allows you to go and see any doctors, any hospital, anywhere in the US, as long as they accept Medicare. And the premium increases by your age, and it does not cover prescription drug. That means you have to go and apply for a standalone prescription drug. Okay, I'm going to stop here before I go to prescription drug to see if there's any questions.
Yes, we do have a question. What is deductible of $203 on the slide regarding Medicare Part B?
That is the deductible for Part B. So if you only have Part A and Part B and you don't have option 1 and option 2, every year you would have $203 deductible when you go and see your doctor. In addition to having to pay 80%, because Part B does not cover 100%, you also have a deductible. Now remember, if you get option 1 and option 2, they mostly cover the 203 and they cover your 20%.
Thanks. When you have Part C, do you also pay Part B premiums?
Yes. You have to have here, you have to enroll in Medicare Part A and B. That means you have to pay Part B to Medicare in order to be eligible for Part C.
Thank you. Any other question?
No? Okay, we move on.
Oh, so premium is higher for Millionaire.
Premium is higher for, well, for a Millionaire, yeah, if your adjusted gross income is higher than 85,000 or 170,000, obviously your premium would be higher for your Part B. But the option 1 and option 2, they don't look at your income.
So if you, so you don't need to do Part B if working.
No penalty. If you have creditable insurance through your work, you don't need it. But you have to be careful. You have to find out if the insurance you're getting is creditable. You have to find out from your company, from your HR.
Thank you. No question. I think we can continue.
Okay, so now we go to prescription drug. Okay, so the prescription drug is also provided by private insurance company who are approved by Medicare, and they provide you a lower prescription drug cost throughout the year. For example, when you sign up for a prescription drug plan, whatever the rate of or the price of the drugs are, that's what you pay for the rest of the year. So if there is an increase in the drug cost, it wouldn't apply to you until the end of the year. The premium would vary depending on the plan. And there is a deductible anywhere from $0 to $445 in 2021. So some plans have $0 deductible, some plans have $445 deductible. So and some have in between. So there is a deductible. And then a Part D prescription drug plan, just like Part B, also has a late enrollment penalty, which means if you do not have a creditable insurance and for 60, at least 63 days or longer in a row, you don't have any prescription drug insurance since your initial enrollment period, then you're subject to penalty. And the penalty is 1% per month, which means it's 12% per year. Again, this is calculated such that if you don't take any medication and you say, well, I don't need prescription drug, but then once you decide you want to apply for prescription drug, they count the number of the months that you were without insurance, and then they assess 1% penalty per month. And usually the 1% is based on the national average premium, which is around $30. And then this is paid for the rest of your life or as long as you are applying for prescription drug. So very important, make sure, you know, at the minimum you have A, B, and D, because B and D have penalty. You know, you make sure you have those three. Okay, here, these are three stages of drugs. Before I cover stages of drug, let me just explain to you what drug tiers are. Each company, each private insurance company who provides prescription drug, they classify their drugs into different categories. They call it tier. Tier 1 is for generic drugs, and tier 2 is tier 1 is preferred generic, tier 2 is generic, tier 3 and 4 are brand drugs, and tier 5 is specialty drugs like chemotherapy or very expensive drugs. So the lower the number of tier, the cheaper the drug. Obviously, generic drugs are cheaper than brand drugs. So when you apply for a prescription drug, first you have to see if your plan has a deductible. If the plan has a deductible on January 1st, when you go and fill your prescription, the pharmacy is going to look at your plan and see if you have a deductible. You have to meet your deductible. If you have met your deductible, or if you do not have a deductible, then from the deductible or January 1st, you start with initial coverage. Now, everything I'm going to cover here, it applies to whether you have a standalone prescription drug or whether your prescription drug is part of your Part C. It doesn't matter. Everything I'm going to tell you applies to both. So once you are in your initial coverage, you pay a copay or a co-insurance. For example, if your generic drug is $50, your copay could be $1 and insurance company pays the other $49. Co-insurance is when you pay a certain percentage, not the dollar amount. So if your drug asks that you pay 25% of the cost of drug, like for you know, tier 5 expensive drugs, then you have to pay the 25% of, I don't know, $2,000, and then insurance company pays the 75%. So you have a copay depending what tier your drugs are. You stay in initial coverage until your total drug cost reaches $4,130. Now these amounts are for 2021. The total cost is what you pay and what the insurance company pays. For example, in our example, when we said the drug was tier 1, it was $50. So the whole $50 would roll into $4,130. You stay in this phase until you reach $4,130. Once you go over, the total cost goes over, then you move to the next phase, which is called coverage gap. Some people refer to coverage gap as donut hole. I don't know if you have heard of that. But while you're in the coverage gap, some plans cover your tier 1 and tier 2 or just tier 1 drugs. But in general, once you are in coverage gap, you pay 25% of the cost of your generic and 25% of the cost of your brand drugs. And the pharmaceutical company pays the difference. You stay in this phase until your total out-of-pocket cost reaches $6,550. Now, your total out-of-pocket is different from your total cost because this total cost included what plan pays for you. What plans pays for you does not roll into this $6,550. So what pharmaceutical pays, it rolls into $6,550. So basically, you're in this gap until you reach $6,550. Once you go over that, then you roll into the last phase, which is called catastrophic coverage. During this phase, you pay $3.70 per month for a month of generic and $99.20 for a month of brand drug, or 5%, whichever is higher. So basically, insurance company covers you here, insurance company covers you here. Here you pay a higher rate unless some of them covers the tier 1, tier 2. Otherwise, you pay a higher rate and the pharmaceutical helps you. So it's very important. The message here is try to keep your drugs generic, because by keeping it generic, a lot of plans, even if they have deductible, they said if your drug is tier 1, they're not going to charge you deductible. Also, when it's generic, your copay is much lower. And also, you may not reach $4,130, so you're not going to roll over into the coverage gap. So it's very important to keep your drugs generic unless your situation is such that your doctor says, no, you have to use the brand name, then you have no choice. So then I'm going to cover some terminology. Pharmacy network. Each plan has its own preferred pharmacy that they claim if you go to their preferred pharmacy, you get a better pricing on your drugs. Drug formulary is a list of all the drugs, usually in the enrollment booklet when you receive or online, you can see for each plan, all their drugs are listed alphabetically, and after each drug name, there is a T and a number. The T is for the tier, and the number 1, 2, 3, 4, 5, it tells you what tier the drug is, and then from there you can find out how much it's going to cost you. Usually I help my clients, I look up their drugs, I go online, look up their drugs to tell them, you know, what the total cost of their drug is for them. And then tiered formulae, we talk about it. Tier 1, 2 is generic, 3 and 4 is brand, and tier 5 is a specialty. Some companies have a tier 6. They have picked up certain kind of commonly used drugs like cholesterol or diabetes drugs, and they group it into a tier 6. But not every plan has a tier 6. Step therapy is the plan wants you to use a generic drug first before you jump into a brand drug, unless your doctor says you have to use the brand. Quantity limit, each drug has a certain quantity, like 1 a day, 2 a day. If your doctor says you have to use more than the allowance, the quantity that the plan allows you, then your doctor has to submit a request to the plan to request that you have to take more. Prior authorization is submitted from your primary care physician. He submits it to the plan to see, like, for example, if a drug is not on the list of formulary and you have to take it, you get authorization. And if your situation is such that there's emergency, you need the drug fast, the coverage decision is made within 72 hours so that they provide you the drug, so you don't have to wait for a long time. Okay, So I'm going to stop and see if there's any question on drugs.
Thank you, Zara. I have two questions. I'm not sure if we would like to keep them at the end. What happens if one decides to retire in a foreign country? Any benefits provided by Medicare?
No, not if you retired in the foreign country. You can go and visit your foreign country for a few months and come back. But if you just retired and stay there, Medicare does not care, is not covered in foreign countries.
Or they can get some money back for not using Medicare system?
No, if you don't use your Medicare system, you don't get any money back.
Okay.
It's a tax you already paid. So if you stay here, you benefit from it. If you don't stay here, that's it. You don't get anything back.
Another question, since Medicare doesn't cover everything, if we buy additional insurance on top of Medicare, which one is considered as primary? Can we coordinate benefits between different insurance plans and Medicare?
Well, if you go with option one, obviously your Medicare is your primary because they cover 80%, and your Medigap is your secondary because it fills the gap. If you go with Part C, A and B is embedded into Part C. You only have one plan. There is no primary, secondary.
Thank you. There is no more question on this part.
So now we're going to cover eligibility period. This is very important. When you turn 65, as I mentioned, if you have paid your taxes, you are entitled to Part A and you're eligible for Part B. So when do you turn, when are you eligible to sign up? The first period is initial enrollment period. Initial enrollment period is when you just turning 65, or you are older than 65, but you're working and you have not applied for your A and B, and now you are you're 67 and you want to go and get your Medicare. So you are in initial enrollment period because you've never signed up for Medicare before. So once you apply under initial enrollment, you have 7 months to apply for your Medicare. The 7 months starts 3 months before the month of your birthday, the month of your birthday, and 3 months after the month of your birthday. So that's basically 7 months that you can go and apply for your Medicare Part A and B, and then go and apply for option 1 or option 2. Now, for example, let's say your birthday is in July 15th. You have from April 1st until October 31st, really a large window of opportunity to go and sign up for your Medicare. If you apply in April, May, or June, the effective date of your Medicare card is July 1st. Regardless of if it's April, May, and June, your effective date is July 1st. Now, all the Medicares and all the plans' effective date is 1st of the month, regardless of what day is your birthday. If you apply in July or August or September or October, usually the effective date is the 1st of the following month. So if you apply in July, your effective date is August 1st. If you apply in August, it's September 1st, and so on. So this is the 7-month period that you have the opportunity to sign up for Medicare. And if you choose option 1 and option 2, is so that you're not considered late and subject to penalty. The next enrollment period is the green area, is annual enrollment period. This is the period we are in right now. It starts from October 15 and ends in December 7. This applies to those who are already in Medicare and they decide they want to choose their plan. Let's say they want to go from Part C, go to a Medigap, or from a Medigap to a Part C, or even within Part C, you want to change from one advantage to another advantage. So this is your opportunity to go and change your plan. Once you change your plan during this period, the effective date of your new plan would be January 1st of the following year. So if you change it now, your effective date would be January 1st of 2020. The next period is Medicare Open Enrollment, Medicare Advantage Open Enrollment. This Medicare Advantage Open Enrollment is a 3-month period from January 1st to March 31st. Now, this only applies to Medicare Advantage plans. So Medicare gives you another 3 months. If you want to change your Medicare Advantage from one Medicare Advantage to another, or from one company to another, you have 3 more months to do it. You can either go from one Medicare Advantage to another, or you can drop your Medicare Advantage and just go to original Medicare and not have additional insurance. Finally, the last enrollment period is a special enrollment period. The special enrollment period could be any time of the year. In order to qualify for special enrollment, you have to have a qualifying event. The qualifying events are either you retire. So if you retired on March 20th, then even though you're out of the open enrollment, or you haven't applied for anything before, you're able to sign up because you retired. If you move out of the service area, so for example, if you have a Part C and you are in Santa Clara County, and then you move from Santa Clara to Alameda County, you are eligible for a special enrollment, because then you have to see what plans are available in Alameda County so you can sign up. If you receive a system like Medi-Cal, you're eligible for a special enrollment. If you have some chronic disease, you're eligible for a special enrollment. And also, if you get extra help with your prescription drug, you're eligible for a special enrollment. So basically, a special enrollment is certain criteria. If you meet, you're allowed to use a special enrollment period. And then lastly, we're briefly going to talk about the extra help with prescription drug. Some people, their income is higher than Medi-Cal. They don't qualify for Medi-Cal, but their income is lower than this thresholds. So if your income is in between Medi-Cal and this number, you are qualified to apply to get extra help with your prescription drug. This is only for prescription drug. This is not for medical services. And then also they look at your assets. If it is below this threshold, then you qualify. Your assets are your bank account, if you have any stocks or bonds, the house and the car, the house where you live and your car that you drive is not considered your assets. And if you qualify for the special enrollment, so this plan would also cover you for your cost of your drugs during the coverage gap, and they may even pay part of your premium, depending how much, how you qualify. If you're in doubt and you don't know really if you qualify for extra help, it's always good to either go to Medicare.gov and apply, or let somebody, your broker, your agent know, so that they can help you to find out if you qualify, or show you where the form is so you can sign and submit it to Medicare. Worst come to worst, they say, no, you don't qualify. So you don't have anything to lose. And last one, this is my business card. You can take a picture, or you're going to get a copy of this slide by the end of next week. This is my phone number, my email, and these are the companies I represent. At this point, I want to tell you, if you have any questions, you can always call me. Calling me is not going to cost you anything, so don't be shy. If tomorrow you realize you had a question you forgot to ask, give me a call and ask me. If you sign up through me, or whether you just have questions, there is no cost to you for my services. However, if you sign up for a plan, that insurance company would compensate me. And whether you sign up by yourself online or whether you sign up through me, whatever is the premium for the plan, that's what you pay. You don't get a discount by doing it yourself. So don't be shy. If you have questions, if you want to switch your plan, if you are not clear as to some terminology, feel free to give me a call. We can talk about it. We can talk about your specific questions that is unique to you, so we can see what's the best plan for you. So basically, this is it. Is there any questions?
Thank you, Zara, for this very informative talk. And thank you again for your time tonight. Let me stop recording, and we will be moving to Q&A session. Thanks again.